Children's Wisconsin says they are no longer providing gender-affirming care to LGBTQ plus patients. This morning I called the hospital to learn more, and a spokesperson sent me this statement saying in part, quote, "We are communicating to patients that due to escalating legal and federal regulatory risk facing systems and providers across the nation, we are currently unable to provide gender-affirming pharmacologic care." The statement goes on to say mental and behavioral health services will continue for patients and families there. And this is an issue I started covering last February when local parents I met with sounded the alarm after an executive order from President Trump threatened to block funding to hospitals that provide this type of care. Back at that time, Attorney General Josh Kaul accused President Trump of, quote, using his power to restrict the freedom of patients and their families, end quote. And right now, the Supreme Court is hearing cases on the issue of transgender women competing on women's school sports teams. Idaho and West Virginia will defend their bans as civil rights attorneys argue they violate the Constitution. The position that the bans are illegal hinges on the Equal Protection Clause in the 14th Amendment. Although a decision isn't expected for months, our Joe St. George says there isn't a definitive way this could go.
The Supreme Court has a bit of a mixed bag on the issue of transgender rights in recent years. They've protected transgender Americans from firings in some cases while upholding state bans on gender-affirming surgeries for minors in other cases.
Right now, Wisconsin is not a state that bans transgender athletes from choosing which team they are a part of.